Welcome to another We Virginians Commonwealth conversation, where we look to the future beyond the current crisis, try to understand the impacts of coronavirus in the country and Virginia in particular. I am Ryan Gilchrist, a journalist and editor from Yorktown, Virginia. Thank you for being with us today. Let me introduce our guests. First, we have retired Rear Admiral Craig Quigley. He is currently the executive director of the Hampton Roads Military and Federal Facilities Alliance. Welcome.
Thank you.
We also have Rich Anderson, retired Air Force colonel and the former Virginia delegate from the 51st District. Thank you for being with us. Looks like we don't have Richard's volume there, so let's.
Okay, I think I'm unmuted now.
There we go.
There you go.
For the intro.
Yeah, the interview would be much less interesting if we couldn't hear you. So.
Oh, maybe it would.
Before we get started, let me introduce my co-host. She is the executive in residence at Hampton University and a former newspaper editor and publisher, Marisa Porto. Hello, Marisa.
Good morning, Ryan.
We have a couple of experts here on military affairs and any number of other things. What would you like to know?
Well, I'd like to ask the two of you to think about public policy in Virginia related to the military and the coronavirus. So let's talk a little bit about what you see happening with the military, veterans, and the coronavirus in Virginia today. Maybe you could start, Admiral.
Sure. I'd be glad to, Marisa. The military has a unique, I think, combination of responsibilities in that it must protect the health of its men and women that are the means through which the nation is protected, but they also need to be ready to fight and defend the nation. So that means I need to be out there as military men and women have been for a long time, on aircraft, in Army units, on ships and vessels of the Navy and the Coast Guard, on forward air bases, flying and doing the nation's business. And doing that while social distancing and maintaining a sense of self-protection are really difficult challenges. So those, I think they're doing as good a job as anyone can hope for. I stay in constant touch with the local military commanders here in Hampton Roads, constantly asking, is there anything we can do to help? And they say, no, we're doing okay. Thank you, appreciate the offer, but we're doing okay. And I see that when I go on board installations as well.
Mm-hmm. Colonel, do you have with your background in the legislative session, in the legislature, can you tell us a little bit about what you think you see from your perspective?
Well, for me, I would have to echo what Admiral Quigley had to say, and that is the necessity for the military, the active military, the Guard and the reserves, those who currently wear the uniform, to maintain the health and welfare of their people so that there is no impact on military readiness. I think the military is probably very well equipped and prepared to do that because the military, obviously, while it may be a microcosm of the general community, it is a closed community and one where senior leaders can exercise considerable discipline and maintain good order to try to combat this thing. I know that several senior commanders early on, when we were all trying to figure this out, took some very proactive measures. There are particular challenges in very close environments, such as the infections we've seen on board Navy vessels. But the military is very well equipped. You know, when we talk about the military and the impact of the coronavirus, I kind of think about it in two terms, two dimensions. First, the active Guard and reserve forces currently in uniform. And then there's that part of the military family, which are military veterans, those who are no longer in uniform. Either they've served a tour or two and separated, or they served 20 or more years and retired from a protracted period of service. So those are two distinct communities, and I really feel much more qualified right now because of where I sit to speak to the whole veteran community. I do know that around me, and I'm a resident of Prince William County, just south of Washington, D.C., that I'm very close, within 20 minutes of Quantico Marine Corps Base, and about 30 minutes from Fort Belvoir, and then surrounded by a whole host of defense agencies. And for instance, the active duty installations themselves, some of them have taken proactive measures to ask that the retiree community only visit the base on certain days unless there's a medical emergency and they need to use the medical facility there. So I think the military is very well equipped to handle this.
Interesting. I did not know that there was they're asking for certain days for veterans to visit, to manage that. That's
correct. And the installation commander is empowered to make that decision locally within guidelines that are provided by their parent service and the Department of Defense.
So can you tell us a little bit about, now there's been some discussion recently about recovery from the coronavirus and what that looks like. Have you all given any thought, or do you know what's happening in the military and in Veterans Affairs related to what the next steps are for recovery? Admiral?
You want me to start, Marisa?
Yes, please. Thank you.
You know, as much as we all want things to get back to normal, I don't think that we're going to get back to what normal looks like until there is a universal vaccine and people around the world have been vaccinated. So I think for the foreseeable future, at least a couple of years, you're talking about a permanent change in behaviors within the military. Recruiting, boot camp, training exercises of all kinds by their very nature had large numbers of people closely. I mean, social distancing wasn't a thing. It really has to be now. If you happen to notice the Air Force Academy's graduation ceremony last Saturday in Colorado Springs, that may give you a sense of what a large group gathering would look like in the future. So here's a little over 1,000 cadets graduating from the Air Force Academy, each of them outside in the football stadium. It's a beautiful day, spaced 8 feet apart just for insurance. No families or loved ones or friends in the stands whatsoever. The whole thing was covered by Zoom or GoToMeeting or some other virtual platform like we're using now. The vice president was the speaker and gave a wonderful speech to the graduates. Again, those stands were empty, and normally there would be thousands of family and loved ones there that would see those cadets become second lieutenants. And that is about as normal as a service academy or any other university, I believe, graduation ceremony might look like for the foreseeable future. So lots of changes that are going to go on, I believe, in all of our lives for some time to come.
You touched on a subject, which was the training of military personnel. So how do you see that in this new world order until we have a vaccine? And either one of you can answer, Admiral, Colonel, whichever one would like to answer that. Perhaps we could go to you, Colonel.
All right. Obviously, there are going to be significant challenges because just the very nature of basic military training and other what we call accession programs, the processes by which we bring enlisted and officer personnel into the military, they're going to face particular challenges because the nature of those duties are close quarters, personal contact, and I'm certain that the United States military is going to figure that out. in order how to do that. So that will be interesting to see how that plays out. If I could, let me just backtrack to one thing, and that is Admiral Quigley spoke of social distancing. I think that's absolutely crucial to prevent passage of the virus from one person to another. For instance, this morning, I had to take my son-in-law to the hospital. He broke an arm, and I had to take him to the hospital for a follow-up appointment. And I wore a mask, and I do not leave the house without wearing a mask. I'm fortunate enough I've been able to. My wife and I found a supply of masks in our garage, believe it or not, that we use for painting.
Lucky you.
So I do have. I mean, you can't find them on the shelf now,
Right.
but so I always wear a mask. I make a point to follow the rules in the store about one-way travel down a given aisle, maintaining 6 to 8 feet distance from others. I think we have got to do that. What we've got here is an interesting dynamic because we have a tension, if you will, that exists between the necessity to curb the spread of the coronavirus infection, while at the same time, what is the impact on business closures on our economy? And I think that's one of those issues that will be debated for in all perpetuity. But I think there is somewhere, some way, a middle ground. We haven't quite found that out yet. Admiral Quigley appreciates this term. It's because right now we are trying to figure this out and navigate in the fog and friction of war. That's invariable.
Colonel, let me ask you to put on a different hat for just a moment.
Okay.
8 years in the House of Delegates, looking at this from a perspective of someone who's sat in that house, what are you seeing in terms of how we're addressing military issues, how the communication has progressed? Do you feel like things are moving in a direction that will allow the military to continue to do what it needs to do and still sort of abide within the restrictions and other things that have been put in place?
Well, I think the active guard and reserve forces will always find a way ahead. By their very nature, they're proactive. They tend to lead the curve on how to handle these sorts of things. The military, in some ways, is well prepared because the military, certain units, train for chemical and biological warfare. And while this appears that its origins may well have been in these so-called wet markets somewhere in Asia, we may never know that for certain because I hear all sorts of theories and counter theories, as we all do. The military is prepared to operate in that sort of environment, and they will definitely figure a way.
Admiral, to get to your point about training, do you see any new opportunities for organizations to train differently, maybe using more digital tools in the future?
Yeah, Marisa, I see a lot more virtual training in the military's future. I think we've all learned in the past 3 weeks or so what you can do. It may be uncomfortable at first, but you can have meetings. You can see people like we are looking at each other on this platform right now. This can be done. And so that's not the way we did it, but we're suddenly put in a circumstance where that's what you need to be able to figure out, and we have. So I see a lot more virtual training in the military's future. You can play that out to a certain extent, and then if I'm a Marine or a soldier and I need to practice being in the field, I can only go so far on a virtual training platform. I need to get out there and do this. So it's a partial solution. I think you're going to see more of it, but it's not a panacea for everything, not by any stretch.
And this question is for either one of you. Do you see any public policy as we sort of look down the road, the 2 years or when we get a vaccine? Do you see any public policy issues that need to be addressed in the Commonwealth to keep military safe, to keep veterans related to veterans or related to military families? Are there any public policies that we need to examine or address to make sure that our military and our related families are taken care of?
Let me speak to that if I could. During my time in the General Assembly for 8 years, I chaired what was called the General Assembly Military and Veterans Caucus. It consisted of delegates and senators who were the clearinghouse. We acted as a clearinghouse for legislation that impacted not only the active Guard and Reserve units on Virginia soil, but our biggest area of focus was for military veterans, because Virginia has roughly 800,000 veterans in the Commonwealth. So in round numbers, about 10% of our population consists of those who've worn a uniform at one time or another. And so I can really speak to that with some clarity. Right now, I'm very pleased about what the Virginia Department of Veterans Services is continuing to do, and they're doing it virtually, and that is to provide such things as their parent organization, the Office of the Secretary of Veterans and Defense Affairs, sits on in the Emergency Operations Center, is available to assist with that. They, of course, are the parent organization for the Virginia National Guard, which has been activated and deeply embedded in a number of these operations. They're very uniquely equipped with that. They're working with a lot of the federal partners, such as the Veterans Administration, DOD, Department of Homeland Security, and the Virginia Congressional Delegation. So I'm feeling very good about what the Department of Veterans Services here at the state is doing to care for the veterans populations and their families. There are about 36 veteran service offices located all around the state. And while they are not open for physical visits, they obviously can receive phone calls, emails, and do virtual consulting, which I think is going to be one of the big spinoffs that we're going to have from all this. I think the biggest change we're going to see is a finally accepting as a society that we don't have to necessarily meet together. After we're beyond this infection, it will not be to avoid infection. It will be to avoid the sunk costs in time and dollars to travel people to meetings when we can do it very effectively here.
Right.
And so I will be very pleased about that. The board that Admiral Quigley and I sit on together, we had a virtual meeting recently, and it was very good. It was the first one we had done. He called that, and we got our business done.
Admiral,
Lisa, can I chime in on that one as well?
Yes.
You asked what public policy issues. We have seen the governor, not only in Virginia, but governors around the country, the president, making a series of very rapid policy decisions to try to get ahead of the pandemic. I think one of the imperatives coming out of this, as it pertains to the military in the Commonwealth, is making sure those lines of communication stay open between the governor's office and military installation commanders throughout the Commonwealth, so that they are aware of when the governor is going to do something that affects the men and women that come and go from their installations. So whatever it might be, if I'm the military commander from that for that installation, I know the governor is going to do this. How does that affect my people? And then what sort of a complementary policy should I put in place so that there is some sort of parity between going outside the fence line and staying inside the fence line to do my job? So I still need to do what I think is best for the safety of my men and women in uniform and their families and the civil servants and the contractors. But I want to know what the governor is going to do so that I can react accordingly. So that two-way conversation, two-way communication channel, even more important in a pandemic.
Well, this has been a fascinating conversation, and I really appreciate the two of you joining us today. I know that you all are busy on many Zoom meetings, it sounds like. So I really appreciate it.
Yes.
Thank you both for being here today.
Can I offer one more perhaps rhetorical question, but something to ponder?
Sure.
And the pandemic is global. It is going to make changes in the global geopolitics that we don't understand yet. But the relationships between nations, the relative strength of nations, economic, military, cultural, will change in some way that we don't know yet. But we have got to rapidly understand those changes when we see them coming, and then make national level policy decisions as to how do I react to that as a nation, as the United States. So this is a huge issue that is very cloudy right now, but it will become clearer over time, and it's a big deal.
Well, I think the Admiral just did the summary for this entire series. So,
right. And it sounds like we're going to have you come back again and speak to what we see unfolding as this pandemic continues.
All right.
Thank you.
all right. Admiral Quigley, Colonel Anderson, thank you so much for your time today. Those of you watching, we appreciate your time as well. If you'd like to see more, you can follow us on Twitter and YouTube at We Virginians. We also want to thank the Peninsula Community Foundation of Virginia for their support of these conversations as well. You can find out more at pcfvirginia.org. For now, that's all. We'll see you next time. Thank you.
Thanks, everybody.
Thank you.